And welcome back. As we mentioned before the break, the suicides of Anthony Bourdain and Kate Spade this week have put a spotlight on a growing public health emergency.
Here now to help us make sense of it, psychologist Dr. Marisa Echenique and psychiatrist Dr. Daniel Bober. So welcome to you both.
Thank you.
Such an important topic to discuss. We appreciate you being here. So the CDC reported yesterday a dramatic spike in suicide since 1999. What are the theories about why this is getting worse?
Well, I think there's a few theories. I think two of the theories are the economic downturn. You know, people fell on harder times. They were having financial difficulties. And the other thing is the opioid epidemic. A massive amount of people have died because of opioid overdoses. And now what we're finding is that a lot of people that we thought were overdosing were actually committing suicide. Mm-hmm. So I think that that's part of the problem as well.
Dr. Echenique, of course, we're talking about two celebrities who took their lives this week. But I don't really know anybody who hasn't at one point in time or another experienced some period of feeling down or feeling lonely, feeling upset about something. What is it that takes someone from those feelings that most of us have at one point in time or another to taking the extreme action of taking one's own life?
Absolutely. And so there's what we call risk factors that it's important for mental health providers and community at large to be knowledgeable and aware of, to be able to detect any of these type of signs and intervene as quickly as possible. And like you mentioned, many people have bad days. Sadness is such a common symptom that everybody can experience in life. And what we look at, some more dangerous signs, perhaps one of the biggest, what we call predictors of suicide, is hopelessness. So when we feel that we can't come out of the bad days, when the bad days become unmanageable, just out of our control, and that we can't see any future brighter, right, anything at the end of the tunnel, then that's when, as mental health providers, we become more alarmed that the person is not able to handle, you know, daily stress, daily problems appropriately, when they see that there's just no way out. So I would say hopelessness is a key predictor, yes.
How does our rate here in the United States compare to that of, let's say, Europe, the European countries where they have kind of more of a work-life balance, they have more time off work, they seem to be less stressed out in general? Is there a difference in the rate?
Well, actually, it's hard to measure because the difference in statistics, the way we collect this type of data here can vary country by country. So I think it's a difficult science to be able to compare. Kind
of like apples and oranges sometimes.
Right, across the board. I think the latest statistic, according to the World Health Organization, had us somewhat in the middle of kind of the country list of suicidality. But I think perhaps what may change are the reasons, or the risk factors. Some may be more cultural, political in other countries, and perhaps, as my colleague was saying, in this country it could be more of an economic issue. Social isolation, I think, is a problem. Ironically, as connected as we are in terms of social media, we are perhaps more apart than ever before.
Dr. Bober, let me ask you, since you're a psychiatrist and you prescribe medication to help people with these types of things like anxiety or depression, how helpful is medicine when someone is dealing with a crisis like that?
Medication is always helpful, but I always tell my patients, if you can do it first with therapy, always try to use therapy before medication, because there's very good evidence. Like, for example, there are therapies like cognitive behavioral therapy, which works very well for depression and OCD, which works as well as medication. So I always recommend therapy first, but in the acute setting of depression, there's some new treatments on the horizon. For example, ketamine infusions work very well for people who have acute suicidal feelings. But with situations like this, with Anthony Bourdain, with Kate Spade, what we always worry about is a contagion effect. For example, we know that in 2014, when Robin Williams committed suicide, there was a 10% uptick in the number of suicides 5 months after his death. So we always worry about promoting these types of events in the media, especially in social media.
Yeah, it's difficult for us, too, as journalists to know what to cover, because our job is to report the news, but of course we don't want to create any problems for anyone else. You talk about social media and the rise in suicide rates in the United States since 1999. That's kind of when the internet came to the fore and social media started to rise. Do you attribute any of it to social media?
Well, I think social media has its many advantages, right? And in terms of how much information, how much information, how much resources people can have so readily available. The other side of it too, I wouldn't say that social media causes these types of behaviors, but for somebody who is experiencing significant distress, they may find, whether it's through social comparison and saying, oh, you know, look what everybody else has and I don't have, there is a danger when used incorrectly. So I think what's important as mental health professionals and the community at large is to help raise awareness and education as to what are the healthy and adaptive ways of using social media and what's not. I think part of the problem of the increase in suicide rates is that more than 54% of these individuals were undetected with any type of mental illnesses. So they did not have a diagnosed mental health condition. So they were living with this significant distress and despair.
Undiagnosed.
Without getting any proper treatment.
No mental health diagnosis.
Which is unbearable.
So, okay, what do we do? If we have a friend, a loved one, who we notice is exhibiting some of the signs that you both have talked about, some of the warning signs, how do we intervene? How do we get involved to prevent something like this happening?
Well, it's always a balance between privacy and public safety, right? So we don't want to be committing people just because they say they're depressed. But sometimes, you know, you have to almost have an intervention. You almost have to bring in family members, friends to say, look, you're depressed, you're not leaving your house, you're not taking care of yourself, you're letting your finances go, you must get help. And if someone is imminently a harm to themselves, very often you have to get authorities involved to get them involuntarily committed. It's a terrible situation to be in. Yeah.
But here in this state, we have something called the Baker Act, where you can have someone
That's exactly what
for
I'm talking
72
about.
hours involuntarily committed. Dr. Marisa Echenique and Dr. Daniel Bober, an important subject, and you both helped us understand it a little bit better tonight. Thank you both for coming in.
Our pleasure. Thank you. Yeah.
And we want to remind you that if you or someone you know is experiencing a moment of crisis, reach out, talk to someone. Help and resources are available 24 hours a day. Look at those numbers on the screen, write them down so you have them, and use them if you need to.